Are we on? Welcome everyone, and thank you for joining your British Columbia chapters of CARP. I am Ramona Captain, President of the White Rock Surrey chapter, and I'm also a director on the CARP National Board. I will introduce you now to our chapter presidents and executives who are on this Zoom presentation, and to our very own BC Seniors Advocate, Isabel Mckenzie, who will be speaking to us soon. As well as Isabel Mckenzie, online we have Fred Hardwood, President CARP Richmond Delta. Sorry, it's Fred Harwood. Karen Tyrell, President North Fraser. Karen Bailey Romanco, President Kootenay. Laurie Harris, Executive Kootenay. Dorothy Leclerc, Executive North Fraser. We are happy and grateful to be hosting this event as we celebrate National Seniors Day in Canada, recognizing the many wonderful older Canadians we have in our communities. Through commitment to remain active, engaged, and informed, we as seniors are demonstrating to Canadians of all ages exactly what it means to age well. We are being super vigilant during this time of COVID-19, and we are looking forward to better days ahead. We have a great program for you today, and we hope you will enjoy and learn from it. And we encourage all of you to vote in the upcoming BC election, which is taking place on Saturday, October the 24th. Be sure to look at all your local candidates and at each party's platform. You can Google the BC Election 2020 Promise Tracker, what the major parties are pledging. If you can't find it, ask a friend or family member to help you. Look at how each party is going to help seniors, families, housing, healthcare, the economy, the environment, taxes, and anything else that interests you. Don't just vote for a certain party because you always have. Get the facts. And please remember to get your flu shot. Make an appointment with your doctor or pharmacy, and please do it soon. CARP recommends getting a pneumonia and shingles vaccine as well. If you would like to ask a question, please click on the chat or the Q&A box at the bottom of the screen. Many of you are doing it already, and we are going to do our best to answer all your questions. Now, I would like to welcome Karen Tyrell and Dorothy Leclerc from CARP North Fraser, who will address urban concerns brought forward by the caregivers they work with in terms of long-term care. Karen and Dorothy will be followed by Laurie Harris, an executive from our Kootenay chapter, who will give us the rural perspective. Thank you, Karen and Dorothy.
Okay, thank you so much, Ramona. Hi, everyone. We are in a digital world now. I hope the technology is coming through nice and clear. Before I begin, I just want to make sure everyone is aware that throughout this presentation, when we use the term long-term care, we're not only talking about long-term care homes, we're also talking about the entire system of caring for someone long-term, which in our definition also includes home supports in the community, as well as assisted living. So this, our time is short today. We have a lot to share, but we only have limited time. So we're only going to give you some high-level items, but we want you to know that you're more than welcome to reach out to a chapter of CARP so that we can continue this conversation. So I'm going to start with some positives about long-term care and focusing on urban regions of BC. Just want to give you some things that we've heard in our circles is that relatively good timing is happening for family caregivers when they want to access a publicly funded bed. So this is good within the urban area. We are also hearing lots of great evidence of many caring staff throughout the long-term care system who are going above and beyond, and this really makes families happy as well as us. Prior to COVID-19, there were decent socialization opportunities for seniors in long-term care homes, as well as in adult day programs and senior centers, etc. Also excited about the 22 new primary care networks, which is providing families, individuals with more choices and better access to doctors. Now, when we went through the concerns that we are noticing within the long-term care system in urban BC, we come to realize that the same challenges are also affecting rural. So here are our top concerns for all of BC right now. Lack of accountability and consistency for long-term care providers. We can go on and on about this one, but for an example, direct care hours are a concern for each resident. Family councils are supposed to be in every long-term care home, but we're hearing that these councils are not being encouraged or being enforced, and there are different policies and procedures across BC happening. Staffing is a huge issue. The numbers are low. There is a shortage going on. And there is a concern around pay because public versus private pay, there's different scales, different levels. We're also hearing a lack of sick time is available for these staff and a lack of appreciation, unfortunately. Training. The appropriate and ongoing training is not always there for everyone. And this is a big concern for those who have to work on a dementia unit, because without the proper techniques and approaches, people can get injured on the job. So mandatory refreshers should be required for these types of units. Now, with regards to COVID-19, here are some top concerns that showed up for us. The impact of that 14-day quarantine that happened for these residents around their mental health. And I've heard people tell me how they've been feeling as though they have been in prison. Wi-Fi is not currently available in all homes, in all the rooms. And this, in our opinion, we feel should be an essential service. This is a better way for families to connect to their loved ones and the loved ones being able to access their families and friends. Staff only being able to work in one location, this has caused definitely more staff shortages. Although there are some positives to this, there are definitely some concerns that have arose. And we are hearing reports of poor air quality and circulation in the older long-term care homes. Lastly, I just want to mention, we are concerned, will our healthcare frontline professionals be able to get through this, or will they become burnt out? So again, all high level, but I'm going to pass things over now to Dorothy Leclerc, who's also a member of my CARP North Fraser team.
Thank you, Karen, and hello to everyone. I'm going to be a little bit of an echo chamber from what you heard on national and what Karen has just said. I'm going to highlight the urgent changes that we have identified through talking to caregivers. The critical lack of frontline staff means we have to do better at recruiting and training and bringing on more staff. We are hearing that there are not clear, consistent policies in long-term care homes. Who defines essential visitor? How can one visitor per resident meet the needs of both the resident and family members? What is the role of private companions who can be a part of the support network using PPEs, of course? Are we making the best use of visits? Are families able to take their family member out for walks and outside a little bit, which we know is a safer environment? We really need to recognize that all accredited facilities need to have vital, active family councils. These councils can help to improve communication between family, residents, and the facility. Family councils should be at every accredited facility. We also want to talk about some of the needed changes for long-term care in the community as well. We need to be more flexible and creative and resourceful in providing for respite. Respite resorts are a resource that we don't have here in the Lower Mainland, but they are private places where you could take someone for a break. We need more and better access to adult day programs. And we also need to have affordable in-home respite for those caregivers who need someone to come into the home to provide them with a break. Family caregivers are the backbone to the community care, and we need to make sure that financially they are not at risk. And whether this looks like a federal tax credit that is refundable or a rebate needs to absolutely be considered. Currently, if a caregiver leaves the workforce to take care of someone, they are accruing zeros in their Canada pension plan, and this puts them at risk when they age. We need to be able to address the fact that Canada pension plan recipients need to not receive zeros when they are caring for their family member or their friend. Those are the urgent changes. They are merely highlights. As Karen said, if you have important concerns, join a local chapter and share those concerns. At this time, I'd like to introduce Laurie Harris, who will be providing a perspective on what it's like to be a rural caregiver. Welcome, Laurie.
Laurie, turn off your mute. Laurie, you're on mute. Turn on your microphone.
Thank you. Thank you, and thank you, Dorothy, and welcome everybody. We've got a map for you here that's showing rural BC's largest issue. It's really big, and sometimes we don't even agree who's rural and who's urban. Generally speaking, we're talking about the green areas here, though. And so what makes rural so different from urban? Specifically, it boils down to population, geographic size, numbers, and the kinds of services, and the accessibility of those services. This grid coming up is for our statisticians. The actual numbers aren't really that important. The point is that the Kootenays, as an example, have about 30% of the population of White Rock, Surrey, in an area that's over 55 times greater. That's an issue. And we've talked about some of the shared challenges throughout the province. So let's look at a few unique challenges for rural BC. I'm oversimplifying, but maybe it boils down to options, accessibility, and connectedness. We need appropriate, accessible, and affordable services. Rural BC does tend to lack large hospitals, airline networks, and other options. People move to our larger centers to access a greater variety of services, but in so doing, they often leave their important social networks behind. About housing, we want choices and affordable choices, and we need to define affordable. As an example, here in the Kootenays, we have wait lists to get into care homes. Someone moving into care may have to take a first available bed in a community that's hours away until their preferred space becomes available. For family, this might mean months of separation. Our second big challenge in rural communities is accessibility. Communication, for example. Some of us have no internet or cell phone reception. Googling something, participating in this meeting right here today, or enjoying FaceTime with the grandkids might not be possible. With regards to transportation, some rural communities just have none. No public transit, no handy dart, or those services only exist within city limits. None of us have Greyhound anymore, and some of our special community buses actually run in the wrong direction. Weather can be an issue for us as well. We get snow, and lots of it. If your only outing is a wheelchair walk around the block, you might be out of luck for a few months. If you enjoy being picked up by a day program shuttle, they might not be willing to pull into your driveway and risk getting stuck. Your nearest bus stop might be blocks away over a really icy sidewalk. And support networks, family and friends so often help us to access services, but what if they live out of town? Or maybe they work 9 to 5 and the services that you need are only open from 10 till 4. Our third challenge is connectedness. In rural BC, we can feel separate from our urban neighbors and even from each other. And remember, we're not all in the Pacific time zone. For those of us who live or work with others in the Mountain time zone, this can cause great confusion. All that said, there are some real positives for rural BC. We applaud initiatives like the Primary Health Care and Patient Voices networks and the Community Paramedic Program. Telehealth and other rural access remote solutions can save us frustration as well as very high transportation and accommodation costs. Aging in place initiatives and a variety of community-based senior services in some areas like Better at Home, Choose to Move, and the Caregiver Family Networks provide home, health, and social supports. We have some great transportation supports like Handy Dart, Hope Air, Freemasons Cancer Car, and other volunteer drive programs. Here in the Kootenays, Angel Flight East Kootenay is quite new. I've got 2 clients in my work with Better at Home in Cranbrook, a mother-daughter team who recently enjoyed a same-day trip to Kelowna for mom's treatment. That's absolutely unheard of. The flight was 80-something mom's first ever flight, made even more special by the volunteer pilot's abilities as a sightseeing guide. These kinds of programs bring us closer together and improve quality of life. Urgently needed changes for rural BC, reliable multi-year funding, improved collaboration between health and community-based services, and plain and simple, we just need more doctors. At the end of the day, it's fair to say that some people fare better than others when it comes to healthy aging, especially those who can afford help. That's why CARP's national priorities around financial security and long-term care for Canadians as we age is so vital. That's it for me. Let's go back to Ramona and learn more about our very special guest speaker.
Thank you very much, Laurie. And now I have the pleasure of inviting our BC Seniors Advocate, Isabel Mckenzie, to give us an update.
Thank you very much, Ramona, and happy International Day of the Older Person and National Seniors Day to everyone. It's an extraordinary one this year in 2020, as you know. But I think we can still look for many things to celebrate, because even though we've had several months of uncertainty, of tragedy, of devastation, I think that what all of us have found inspiring is that as the issues and challenges and fault lines related to seniors care have revealed themselves, the response of the public has been one of this just won't do, we have to do better. And that's important, because it could have been met with indifference and it wasn't. So I think then we have to harness this goodwill that exists out there right now and make sure that we sustain it over time as COVID will pass, as inevitably COVID will pass. It's unclear when, but we're assured that, that it will pass. I'm just going to focus a little bit on some updates. I know that I spoke to the BC chapter a few months ago now with a fairly comprehensive presentation of sort of the state of things related to seniors. And for the most part, that hasn't dramatically changed. So I'm not going to go over all of that. I'll just sort of highlight some of the new things. Now, Ramona, you were encouraging everybody to get their flu shots. Absolutely. In fact, the way you can protect the older adults in your life is the younger you are, the more effective the flu vaccine is. So in fact, the more important it is for you to get vaccinated. One of the things that will be happening this year, and I know that this is an issue that CARP has raised consistently, is the high-dose flu vaccine. So the province is going to make the high-dose flu vaccine the vaccine that's used in our long-term care system in BC. Prior to announcing that, they needed to secure enough doses. You can't promise to deliver the high-dose flu vaccine without having enough doses. It is possible that one of the things we will find this year is that for the rest of us who choose the high-dose flu vaccine, there actually may not be as much available in the public. There's only so many doses. So that is something I think we need to just be a little bit aware of. Hopefully, this can be a building toward pivoting over to the high-dose flu vaccine as the default vaccine. But I think it's just the practicalities of how many doses can be produced. The province did secure a significant greater number of the regular flu vaccine in anticipation of more people receiving the vaccine. And there's going to be a campaign by the provincial government to promote it more than it usually is promoted. I will be adding my voice to that, although I think they'll have a bigger, more effective voice. And my message will really be centering around, if you really care about your grandma and your mom, get yourself vaccinated. That getting mom or grandma vaccinated is important, but the greatest protection is that you don't have the flu and bring it to them. So that will be a little bit of a more forceful message this year than I think in other years. It doesn't protect people from COVID, but what it does do is it will reduce the probability that somebody will develop a severe enough flu to require a hospitalization. And that's really what we're really focused on, is we want to keep our hospitals as uncongested as possible in the event that we need to have additional beds for people with COVID. Now, you've all been following the numbers. I would expect you're probably on the BC CDC website and following the statements in the bi-weekly, or not bi-weekly, semi-weekly briefings. So our caseload is high relative to what it was even at what we thought was the peak of the pandemic. But what is important indicator, the reproductive rate, the R0, you've all heard about that, is actually still hovering only at about 1, because while a greater number of people are testing positive, they're not exponentially impacting. Our line is not going like this. Our line is more like this. It's higher than our line was at the peak. That's true. But the trajectory is not what you're seeing in Ontario right now. And that's what's important. The other thing that's important is the hospitalization rate relative to the number of cases. So if we look back at the peak of our pandemic, I probably should have tried to do this as a screen share, but I'll explain it this way, that the line up here was the hospitalization rate, and the line down here was the active COVID case rate. So you had a very high number of hospitalizations relative to COVID cases. Now that's reversed. So we see a low hospitalization rate relative to the number of COVID cases. So numerically, at our peak, we had 150 people in an acute care bed when we were averaging something like 60 or 70 cases as a 5-day rolling average. Our 5-day rolling average now is about 100, and we're at 70, I think. So, you know, it's sort of half what it was. And we've had these high numbers now for quite some time. So if we were really if it was really going to spike, we would have seen it. It's been growing because there's a lag between test positive and a hospitalization usually. But they're thinking that the number is about where they want to see it. And I'm certain you've all heard the provincial health officer does want to bring the numbers down as we head into influenza season, in part because we will be inside more, and if we are infected, we will have a greater probability of infecting someone else than when we're in the out of doors. Moderating that, however, is the possibility that we got the summer vacation out of our blood, and we're now going to be more prepared to return to the more limited life that generally comes with going back to school. And so we may start to see, and there is a sense that, you know, our line is not going like that. It's here. It's too high, but at least it's not going like that. So that's where we're at with the with our COVID cases at the moment. When I look at some of the impacts on seniors, Karen has talked a bit about long-term care. Certainly, when we look at, you're starting to hear a number of outbreaks. What I think is important, and I've got the latest numbers as of night before last. So what is this, Thursday? So this is end of day Tuesday. Now, we have 560 sites, combination long-term care and assisted living, that are under the PHO orders. It doesn't count independent living. It's assisted living site or long-term care site. And it represents about 40,000 people. 55 of these facilities, so about 10%, have experienced an outbreak. So 90% have not experienced an outbreak. There have been 61 outbreaks because some facilities have experienced more than one outbreak. So that's why there's more outbreaks than facilities experiencing an outbreak. So 37 of the 61 outbreaks resulted in no deaths so far. And so we need to keep that perspective. 28 of the 61 outbreaks, so almost half, were contained to one staff member. We declare an outbreak on one test positive case, whether it's a resident or a staff member. And almost half of our outbreaks never went beyond the one test positive staff member. We also had 7 outbreaks that were a single resident. Now, I'm a bit curious about that because how did the resident get it? It is possible that when we see a single staff member or a single resident, that there is a false positive. But that a false positive is possible. It's not probable. And it would not, most of the cases would not be, might be 1 or 2 that were a false positive, and you would be more likely to have seen that in a resident because we can't track how they contracted the virus. 5 of the outbreaks were contained, what we would call contained. So it was 5 or fewer, combination of residents and staff. Then we start to see 5 to 15, that's getting a little less contained, and that was about 10 of our outbreaks. 11 of the outbreaks were what in my world I would call, it got out of control, and that is when we had more than 15 cases between residents and staff members. So, I think that that's important that when you hear about an outbreak, that's only one number. The next number is, okay, how many people within the care facility have become infected, and some of those outbreaks will be contained to a single staff member. We currently have 12 active outbreaks in long-term care. And here in BC so far, as of the end of the day Tuesday, 61% of our deaths have been in care homes, but 96% of all deaths have been people over the age of 60. So, one of the things we need to remember is that, from my perspective, the percentage of people that died in a care home as a percentage of COVID deaths is one number, but you have to put it in the context of how many people over the age of 85, for example, or the average age in a nursing home. Because when we compare ourselves to other countries, we need to appreciate that we may have more people, a higher percentage of our population in a nursing home here, and that's why our rates are higher versus in the population at large. So that's where we are right now with our long-term care in terms of our COVID outbreaks. You also highlighted the visitor restrictions. As you probably all know, my office has completed a survey. It ended at midnight last night. We will be releasing by the end of the month the results of that survey with some recommendations. You also talked a lot about resident and family councils, and I couldn't agree more. And I think you can look for a recommendation around that in as part of the report on the survey. We got about 13,000 responses to the survey. So that's telling me that from a statistical research perspective, that is a big, what we call a big number. It's highly representative. I've had an initial scan. I had an initial scan sort of halfway through and then at the end. And when you, I won't get into all the details, but when you do these surveys, you do some checks and balances to make sure, you know, if this answer is right over here, then this answer over here should look like this. And we've done some of that, and I'm fairly confident that the survey is basically telling us of the experience of people. And, you know, the initial results, you know, like all things, we need to, when somebody says most people, you have to say, well, if you're saying the majority, that means 51%, which means it doesn't apply to the 49%, right? It depends. So that's why I'm very keen always to put all questions and all answers for our surveys out in the public domain, and we will do that with this survey as well. But clearly there is an undercurrent of exactly what we're hearing is reflected in the survey, which is differences in how visitor access is being administered, for want of a better term, in different locations in the province, et cetera, et cetera. So we're just, as I say, in the midst of putting that all together. But I would expect, I think we've targeted the last Tuesday in October or something. It's going to be quite daunting to produce it by then. But I made a public commitment, so we would be driven to that to meet that deadline. I find if I don't set a deadline in the public, then sometimes these things can drift, and it is important. We've got to understand that by the end of October, it will have been 8 months, and I don't have to tell you that's a lifetime for many people. That is a lifetime for about 4,000 to 5,000 of our people in long-term care. And we are looking at the next year. I think that we all recognize that given the seriousness of this virus on the older population, that long-term care will be the last place that we will see the total lifting of all manner of restriction and a complete return to normalcy. And so we are looking at a minimum of the fall of 2021 before we see that happen. And it could well be into 2022 before we see that happen. That's going to be to a large extent up to our PHO. And, you know, if you look historically at when the WHO will declare a pandemic over, if you look, for example, at H1N1, I don't see that the pandemic is going to be declared over much before spring of 2022. But life can return to normal in a lot of places before the pandemic is officially declared over. As you know, they'll be very cautious before they do that. So I think that is driving a lot of my sense of the timeliness of this and the importance of this, that when we started out, okay, if it's 2 or 3 months, that's one thing. And I think a lot of us thought that that's really what we were looking at. And it's become clear that's not what we're looking at. So I think we need to adjust on that. And you've talked a lot about staff and staff shortages and unintended consequences of some of the good things we've done, like single site orders, et cetera, et cetera. We will have to, you know, these things, there's an impact that will take time. It's not a light switch where the problem is solved overnight. But I do think that under the PHO's orders, so related to the pandemic and the state of emergency, as long as that's in place, we will have this wage leveling. And that, I think, is going to have an impact as we recruit new people. Now there is a lag time, right? Because if it's going to be encouraging people to come into the profession, we're not going to see those people for 6, 9 months or a year because they have to be trained. So, but I do think that as we look to the future, we will start to see the impact on that. And I think the other kinds of supports and programs for seniors, and you talked about, you know, long-term care is in the community at large, that, and we are monitoring those. Some of the challenges, older adults, seniors, frailer seniors, and their family members having confidence to re-engage. So whether it's going back to adult day programs, this challenge of the 14-day isolation upon going into long-term care or into respite, because that's, you know, you have to isolate for 14. That's I have to say that that is a difficult one. There is a 14 days. It's a burden. It's onerous. I've never had a 14-day isolation. It's not, I can imagine it's not as easy as it sounds. You know, we sort of say, oh, go self-isolate for 14 days. That's 2 weekends. Actually, that's when it starts to dawn on you that this is a difficult time. And picture yourself in a hotel room for 14 days, 2 weekends. But there's a possibility we could, with an approach to testing, maybe shorten it to 10 days, but I think that it's going to be challenging to, we may be able to make that isolation look a bit different. But at the end of the day, for the most part, it's going to be keeping the residents away from the other residents. That's really what it's about, because the staff are providing the care, so the care is still happening. It's about keeping them away and possibly transmitting it to other residents, because because residents aren't in full PPE. It's only the staff, right? So that's a tricky one, and I don't know that there's a solution to that one. And I'll just close out by Laurie, on your report on rural and remote, one of the systemic reviews my office is going to undertake, and we're trying to map out our calendar of systemic reviews, which has been upended a bit by new work we have to do related to COVID, but it is specifically about the experience of rural British Columbians. And we originally would have launched that in early 2021 and had that report come out in 2021. I think we're going to take a look at what's our ability to get out into other parts of the province and really get a sense and talk to people in a more, Zoom is great, but you miss some things in Zoom, right? So we're going to be, that date of that report has definitely been pushed back because of COVID, as has our report on Indigenous seniors been pushed back because of COVID, just because of our ability to consult. Other reports, however, will continue. We have a report coming out probably in December on abuse and neglect. We have our usual reports. Our Quick Facts Directory update will be coming out later this month, and then our monitoring report. And it occurs to me with this new technology of Zoom that the BC chapter may be interested when certainly the monitoring report comes out, because that's a whole bunch of indicators related to seniors that I'd be very happy to do a presentation, a Zoom presentation with the data that's in that report and go over that and answer any questions. So I think I'll wrap up with that and turn it back over to Ramona, and I'm happy to answer any questions if there are any.
Thank you very much, Isabel. It's always a pleasure to have you join us, and you do so much for CARP. We're very, very appreciative. Unfortunately, we can't have a Q&A online because we will run out of time, but we have given everybody in the chat section your website where they can go and find out more, and they can contact you and ask their questions directly. So thank you very much. And now it's back to Karen Tyrell.
So we're going to be just sharing a recorded video with you. I hope you'll be able to hear it. There is a garbage truck going by my home outside. I hope it doesn't interrupt. So here we go. Hi everyone, my name is Karen Tyrell and I am the president of CARP North Fraser. I have with me Karen Bailey Romanko, who is the president of CARP Kootenays.
Hi everyone.
CARP is Canada's largest advocacy association for older Canadians. In the previous presentation from CARP National, you heard several Canadian celebrities that we have come to know over the years. However, for this segment, we would like to showcase a few not so well-known Canadians. However, in our eyes, these individuals are definitely celebrities. And these individuals live in BC. They are over the age of 50 and are living life the best way they know how. Today we have Margaret Rowe from Coquitlam, who will be representing urban BC. And we also have Pauline Waterfall from Bella Bella, who will be representing rural BC. So what I'm going to do is I'm going to pass things over now to Karen from the Kootenays to help us get to know these individuals a little bit more.
Thank you, Karen. Why don't we start with telling us a little bit about yourselves? Margaret, do you want to start? Just give us a little bio of you.
Thank you, Karen. Yes, my name is Margaret Rowe. I live here in Coquitlam. I've lived here for about 30 years. I've lived in this beautiful province of British Columbia for 44 years. My husband and I raised our family here, and he worked here with BC Hydro for many years, and I worked for a financial institution. And I'm a grandmother as well, and I really enjoy my grandchildren.
Great. Thank you, Margaret. And Pauline.
My name is Helistis Pauline Waterfall. I was born and raised in Bella Bella, where I continue to live. I've attended day school here. I attended residential school. I finished my formal training at UBC. I'm an educator, and I'm a retiree wannabe. I'm a grandmother, great-grandmother.
Sure. Thank you, Pauline. Okay, a couple questions for each of you ladies to hopefully share with us. Starting off with what makes you excited in the morning? What do you look forward to every day? Margaret?
Well, in the beginning, it was very difficult. But the very first morning after my husband's funeral, I just didn't want to get up out of bed. But unfortunately, I had to get up because I had to go to the washroom. So right then and there, I decided that once I put my feet on the floor, I was not going to go back and get back in bed, even though all I wanted to do was just pull the covers over my head and stay there. But I was determined. I promised myself I wouldn't go back to bed, and I didn't. I just was determined that every day, as hard as it was, I was just going to move forward and carry on. And that's what I did.
Thank you, Margaret. How about you, Pauline? What gets you going every day?
Well, we live in a small community, 1,400 people, and we are working hard to take care of ourselves and make good decisions around this uncertain time with the COVID-19 pandemic. There's always decisions to make in context of keeping us safe. And so it's part of the whole just to be involved with that and to know that each day we really need to be aware of our opportunities just to adjust and to adapt as best we can. I look forward to my yoga every day. I still do that. And meditations every morning. My days always start that way. And I look forward to being with my grandmother, my mother, who's 93 years old, and have the privilege of taking care of her.
Thank you, Pauline. So what about your greatest moments or accomplishments in the last sort of later years? Margaret?
Well, first, I would have to say that it was being the primary caregiver for 16 years for my husband. It was a very difficult process. There was days when I thought I would never survive, but I have, with faith, family support, a dementia day program for my husband, and a dementia caregivers group for me, which was facilitated by this wonderful lady, Karen Tyrell. I managed to survive and live to tell the tale. And the other thing that I'm proud of through all those 16 years, with my son's encouragement, I was able to carry on with the, I'm president of a charity organization here in the Tri-Cities. And he really encouraged me to carry on with that, because he very wisely said to me one day in the beginning, he said, "Mom, you have to have something else to focus on besides Dad." And he was just spot on when he said that. So I did that, and plus I was also able to spend time with my grandchildren, which just was wonderful. It was such a reprieve from taking care of my husband for so long. So those two things, I think, since my retirement in 2003, I think have been the greatest things that I've done.
Thank you. And Pauline, I know you're not retired. I know you keep going there, but highlight your proudest moment in the last while, please.
I think continuing to be in education still is important work for me to do. I teach as an adjunct professor with Vancouver Island University, and we teach the stewardship program, and I've developed a First Nations culture and history course as part of that program. And the impact of that upon the students is life-changing for them. And they continue to work to take care of the natural world that we live in. And I think my proudest achievement is just continuing to stay in touch with the 75 or so graduates who, through Facebook, who just support each other, and it's an extension of our immediate families. I'm also really involved in continuing to rebuild our community and our infrastructure. And at this time, I'm doing a contract with another colleague to create a HESA constitution based on our traditional governance model.
Thank you, Pauline. So what's your hope for the future, ladies? Well, Margaret, what's your hope for the future?
It's been 1.5 years now since my husband passed away. So I am now starting to readjust, my lifestyle. I want to continue to focus on the charity work that I do. I do work here in the Tri-Cities. And I also want to start traveling again. It was just something that my husband and I couldn't do for many years.
Thank you. And Pauline?
My hope for the future is that we can continue to work together to, as a human family, to take care of our natural world, our environment. There are many forces that are upon us that are calling us to action in context of global warming. We've had natural kind of disasters that are upon us, and my hope for the future is that as a human family, that we really can draw upon our individual strengths in order to create a world that is good as or better than the world that we inherited.
Thank you, Pauline. Karen?
Thank you so much, ladies. It was such a pleasure to get to know you a little bit more and share with others the realism of life for people over 50 here in BC. From my perspective, what the message I heard was there are a lot of unique, we are all individuals, but yet there's lots of commonality between us. A passion for life, wanting to help others, and just doing our best to survive through this journey of life. So thank you once again, and we really appreciate you being here.
Thank you.
Thank you.
Okay, and so now I'm going to pass things over back to Ramona.
Thank you very much. And thank you to everyone who joined us today. This has been fabulous. We've had so many questions, so much going on in our chat boxes, and Fred has been very busy answering as many as we could. So I just want to let everyone know before we end our presentation today that CARP works tirelessly for older Canadians as we advocate for better health care, financial security, and freedom from ageism and discrimination. Like me, I am sure many of you resent being told that you are too old for this or you're too old for that. We are never too old for anything we want to do or that we can do. Our hearts remain young. On that note, I would like to end with a warm farewell from us, and I would like to give you a verse from the song Forever Young, written by Bob Dylan. I'll not read all of it as we don't have time, but I will end with the last verse. May your hands always be busy. May your feet always be swift. May you have a strong foundation when the winds of changes shift. May your heart always be joyful. May your song always be sung. May you stay forever young. May you stay forever young. Thank you again, everybody, for joining us. This is the end of our presentation. Stay safe, be well. Thank you and goodbye.
Thank you, everyone. With our recording on, we should be able to have all the chat saved as part of the recording. I'm not sure about the Q&A, so I just tried to copy it all over onto a Word document, so we'll have all of that. We still have 74 other people listening in, so this is actually fun for some people. They get to listen in to the people talking about how it went. Well done, everyone.
Thanks, Fred. I'm just reading the chats now, and I'm reading all the thank yous, and we definitely appreciate that. And feel free to stay in touch with your CARP chapter.
I see one question here about, is there a CARP chapter in Nanaimo or on Vancouver Island?
Not currently. If that person's still online, well, Ramona, you'd be better to answer that question, being on the board of directors.
Yes, unfortunately, we did have a chapter on Vancouver Island. We should have a chapter on Vancouver Island because there are many, many older Canadians living there and retirees. We are working on it, and as soon as COVID-19 is over, we might definitely see some changes. We did have quite a number of chapters when we first started CARP, but many of them, for some reason, it's always hard to find someone to take over. As you know, I have been with my chapter for 12 years now, and we love to do succession planning, but often it's difficult. So if you would like to volunteer with CARP, please give any of the chapters a call, and we will welcome you with open arms.
There's another comment about in rural areas. This is from Janice. In smaller communities, is it possible to set up buddy systems to keep connected? A program that gives educational credits for volunteering for seniors in their homes? That's a really lovely idea. The high schools have a requirement for volunteer hours, 30 volunteer hours for high school students to graduate. It would be really neat if there was some other volunteer incentive, whether it was a tax incentive or whatever. One really encouraging thing that did happen recently, I actually have a staff member who is applying for on-the-job care aid certification. So she will be learning next week whether or not she's accepted into the program. And then she will be going, if she is accepted, right into one of our long-term care homes and learning and earning her credits on the job rather than having to go to school for 2 years and then go to work. To me, that's a really positive move.
Oh, absolutely. Sounds wonderful.
I know SFU has done some in the Lower Mainland, but maybe connecting with some of the other universities. But again, it's back to what you were saying, Laurie, about rural situations. They have to be creative in meeting this need. But there's been a lot in the chat also about the concepts of socially connecting. And there's so many opportunities that we could do this. We can still be physically safe like we are today. None of us are touching one another. We're not passing a virus on to one another, but we have an opportunity to talk and be part of this. So as each of our chapters are, we're starting to do a lot more online meetings, and maybe we should have some online socials or just different ways to connect people in different ways. I know our church has had 3 different trivia nights where a whole bunch of people come on, we break out into teams and have a trivia contest, and just a fun way to stay connected that way. Keep our brains going too.
Yes, there's a lot going on in many of our communities. If you check with White Rock City Hall, Surrey City Hall, they all have seniors online programs. Also, Semiahmoo Seniors Planning Table here in White Rock, South Surrey, will be putting on a online Christmas party with entertainment. And so there is an awful lot going on. It's just that, you know, you have to find them. So call 211. They have lots of information. That's a very good number to call, 211. And if it's a health problem, of course, call 811. And you will get a nurse practitioner on the line who can help you out. But for any social or any questions that you may have, just pick up the phone, dial 211.
I'd like to also add about 211. Those of us out in rural communities have not had that service. I know that it's been enjoyed on the Lower Mainland for a couple of years and it's very familiar. So we're just starting to try and get the word out about 211 in rural. Because of COVID, it has been made available all the way throughout the whole province. So if you live in one of those areas and you haven't tried it, please do, because they can answer questions about some of our rural stuff now.
So if there are no other comments, then I think we can call it a day. And thank you, everyone. A very happy National Seniors Day to you all. Stay safe, like I said before, be well, and until we meet again. And too bad I can't do a Vera Lynn, but if I could, I would. Bye, everybody.
Thanks, everyone.